Thank you for joining LanguageLink. Today, we will be discussing the topic of requesting specific interpreters under the Healthcare Authority Interpreter Services Program. Our learning objectives will be to learn where to request, when to request. We'll define medical necessity. We'll also discuss when not to request, potential outcomes of doing so. We'll cover gender requests. And finally, we'll end with a Q&A slide. Where to request a specific interpreter. This is under the appointment section of each form to request an interpreter. Here, for the individual request form, you'll see it's in the appointment section under gender requirement. The same for family appointments. And for linked appointments over 90 minutes, our faxed form includes two sections listed. One to name the requested interpreter, and the second is for the requested interpreter reason. Please note that the reason should derive from the list given on the portal. When to request a specific interpreter. Specific interpreters are to be requested only when it's medically necessary. So under this umbrella falls active cancer treatment, applied behavior analysis therapy sessions, cancer and dialysis treatments, continuing counseling sessions, and finally, effectiveness of treatment plan. Effectiveness of treatment plan is often misunderstood or even misapplied in that providers are not adhering to the main umbrella requirement of medical necessity. Let's define that. Medical necessity are services to cure, diagnose, prevent worsening of conditions that endanger life, cause suffering, or can result in an illness or infirmity, threaten to cause a handicap, or cause deformity or malfunction. Typically, this does not apply to a routine dental or doctor visit or physical therapy sessions. All specific interpreter requests must be documented by the treating physician, not the referring doctor or other staff members. Now that we've covered when to request and the guidelines associated with that, let's discuss when not to request a specific interpreter. You should not request a specific interpreter if the reason is not of medical necessity. These include, but are not limited to, the interpreter is not from a specific country, the patient has worked with the interpreter before. This is often thought of as continuity of care. However, meeting continually with a specific interpreter doesn't always constitute medical necessity unless the treating physician has documented reasons. Another reason to not request a specific interpreter is if the patient has requested them, if the interpreter knows office procedures, to satisfy personal preference of patients, staff, or doctors, and if the interpreter has even requested themselves. We highly recommend that you do not request for one of these outlined reasons. And if you are debating on if your reason meets the criteria of medical necessity, please feel free to reach out to LanguageLink and we can offer our assistance. Potential outcomes of requesting a specific interpreter when it does not meet medical necessity include the healthcare authority can request supporting documents. We can block your ability to request specific interpreters and potentially even send you a bill. You are able to submit gender requests through your portal as well. This does not require documentation. Under the appointment section, you'll see that there are gender requirements listed. You can request either male or female. Commonly, this is requested when the patient or client feels culturally, mentally, or physically more comfortable with a specific gender. Please note that if you do request one gender over the other, this can reduce your resources, especially for languages of lesser diffusion. You can always edit gender requests. So if you've requested, say, a female interpreter, and you notice that 2 days out to the appointment you haven't had any luck in securing an interpreter, you can always change that back to NA, and that will then open it up to the entire resource pool of interpreters in your area. Should you request a specific interpreter? Let's go over some options. Active cancer treatment. The interpreter has interpreted for the patient before. A routine dental, physical therapy, or medical appointment. Cancer and dialysis treatments as requested by the medical provider. Continuing counseling sessions. The interpreter knows office procedures. Or the doctor has documented where a change of interpreter can impact the appointment effectiveness. So for these listed here, should you request a specific interpreter? You can request a specific interpreter and meet the contract guidelines for active cancer treatment, cancer dialysis treatments, continuing counseling sessions, or an appointment where the doctor has documented where a change of interpreter can impact the appointment effectiveness. Thank you so much for joining us. Please email hcaproviders@language.link with any questions, comments, or concerns.